Today's show sponsored by Memorial Clinical Associates, specializing in senior health.
Welcome back. Today, more and more people are finding a few generations under one roof. They have to take care of their children, themselves, and now they're looking after their parents as well. Please welcome Jane Bavineau with Sheltering Arms to give us tips on how to become that caregiver. This is, I guess, relatively new for a lot of people in the United States, because around the world we know that, grandma and grandpa are likely to be right there in the home.
Right.
We've been a little bit different here. So we are finding 3 generations under one roof now. So the first thing you need to do is to realize that you may become that caregiver.
Well, it's very common, and actually what's interesting about our own community is the number of people that are actually in this role that don't necessarily think of themselves in this role.
Right.
And so, like we're talking 30% of the population here is involved in providing some level of care, and it's really important that people recognize this is not always easy, and there's things they can do to make it easier on themselves and their loved ones too.
Right. Just to give you a bit of perspective, Harris County residents over 65 increased 28%, and over 85 years old increased 52%. So in the last decade. All right. So you think about it now and talk to your loved ones,
Right.
including your own family, if it becomes a situation where
Right.
the parent's moving in.
Right. Deborah, that's probably the thing we at Sheltering Arms we talk about a lot, and that is that folks don't think about what if soon enough, and so they come to us in a state of crisis, which is not the time to make a good decision about what you want. And so it's important that families talk about this. Again, it's not pleasant to think about what would happen if I'm not able to run marathons, but we have to, and we have to talk with the older people in our lives about what they want and what's important to them, because we think we know and we rarely don't.
Consult a professional.
Consult a professional always, because these are hard times. These are hard conversations, and families, this will bring out kind of every dysfunction your family ever had. And it's an emotional time when you're trying to make decisions for the long term, and that's why, again, at Sheltering Arms we have social workers and care managers who can help families look at what their options are, kind of objectively help them probe into what's out there for them.
I have a friend who, she said she felt really bad and guilty because she felt angry because the college fund she was saving for her children actually went to care for her parents. And she goes, why do I feel angry about that when that's my parents? I shouldn't, right? But they were able to kind of take care of that through a lot of the programs that you all have, and some of those are even just getting them out to socialize with other seniors.
If you were to ask all of the people in your audience and the people that you've talked to today what their kind of key to success is for successful aging, they would tell you it's because they're involved with other people and because they're active. So I would totally agree that that's the right thing to do. Now, you get to a point sometimes where you can't be as active as you want, and that's why, again, we encourage people to look at what other kind of options are out there to bring help in or to get help on the outside, but not necessarily running races.
And then of course it's the financial cost, and then helping to figure out what options there are for a senior citizen, your parents coming into the home, and figuring that all out as well, and healthcare and the whole bit.
Well, and I think this is one of the things that people are often misled about or don't understand are the costs of some of the care that's provided out there. I mean, do you have $50,000 extra for assisted living, or do you have $18 an hour for home care? And so again, at Sheltering Arms we work really hard to help people look at what their options are in the context of the cost. The other truth is people think, oh, Medicare pays for this. My mom has Medicare. This is all good. It's not all good, and Medicare does not pay for a lot of what older people need.
Pre-planning is important.
Critical.
We had this conversation with my parents, and my mom goes, I
Good
don't like your color scheme. I go, well, Mom, I need your recipes. So both of y'all get down here. Anyway.
That's right.
Well, thank you very much for giving us this to think about. For more information on Sheltering Arms, you can go to shelteringarms.org. They have all kinds of wonderful programs to help families. Let's check in with Nifty After 50 for some more tips for seniors. Hi there.
Hi, Deborah.
Hi.
We're back here at Nifty After 50. And, core muscles are so important to stability. In fact, we tell our patients all the time that just walking won't provide you with the muscle strength you need to correct should you get off balance a little bit. Here they teach self-defense, and this is a great way to learn the core muscles. Jill has something she'd like to show us right now.
Oh, great. Well, this is Barbara. She's going to be portrayed as being an easy target. So this attacker's going to come up from behind. She's going to rip his arm down while leaning forward and then going and jabbing him back. And great job, Barbara. Now go get him. Now back to you, Deb.
Thank you very much. We love it when a senior takes somebody down. Okay, after the break, if you're a senior and you've been hurt, we'll tell you where to go to get the quickest, most convenient care.